That's working. Hello, good morning, everybody. Fergus Dolan here from NALA. You're very welcome to this morning's webinar on health literacy. I'm delighted to have Nicola Culloty. Nicola is a primary school teacher and cognitive behavioural therapist, and she's going to take us through her presentation on building health literacy. And just for anyone who's logged on in the last few minutes, what we're going to do is I'll close down my camera and mic once Nicola starts the presentation, and Nicola will present, and then at the end we'll have time for questions, maybe 10 minutes, it depends. So we prefer to do the questions through the question/chat box, but if that doesn't work for you, you can click on the hand symbol and raise your hand and we can unmic you. So I'll hand you over to Nicola. All the best.
Thank you, Fergus. Morning, everybody, and thank you to Fergus, first of all, for asking me to present this webinar on building health literacy. As Fergus said, I'm a primary school teacher and I've also become a cognitive behavioural therapist and a former homeschool community liaison as well. So building health literacy is an area I'm really interested in and something I'm very passionate about as well. So just to look at what we're going to look at today, a little bit of an overview. We're going to explore what is health literacy and why it matters. We're going to look at the outcomes of having a low health literacy, and then we're going to explore the determinants of health and health promotion. We're going to look at minority and migrant groups and the impact of low health literacy on these groups. We're also going to look at low health literacy and the impact that this can have on mental health and our self-esteem. We're going to explore health literacy in a pandemic. And then we're going to look at empowerment and resilience building and how this can overcome those barriers of low health literacy. And finally, we're going to look at some reading resources as it is National Literacy Week for parents with low literacy levels. So first of all, I'd like you to focus on this key concept in relation to health literacy. I think it's really hard not to see the importance of health literacy when you take the information in this into account. So I'm just going to give you a minute now just to read what's on the slide, and just, I suppose, if you could focus on this for the webinar as we go through the webinar. And now we're going to pause. I had to find a friend in the furthest away place in Norway to translate that sentence for me. And when I put it up, I just want you to think, what did you instantly, I suppose, think of? Did you panic for a bit and think, what's this person talking about? What has she got on her slide? It's not my language that I'm reading. So this is actually what that is translated into. It's building health literacy through empowerment and understanding at a time when 4 in 10 Irish people have limited health literacy. And I wonder if that's what some people, I suppose, experience, maybe when they go to a doctor with a pain in their stomach. And he mentions that, it's a general abdominal pain and, you're going to be sent maybe for an ultrasound to see if it's colitis or something. What words did you see in that slide that you recognize? Was it the 4 in 10, or maybe you speak Norwegian? In that case, my slide didn't work. These are other, I suppose, times when we go to an appointment, or we are given a diagnosis, or we're given medication. All that text that we can see there, all the text with times and how we take steps, and yes, there's pictures there, but is it difficult for somebody with low health literacy to understand what's being asked of them? So what is health literacy? Health literacy is the degree to which individuals have the capacity to obtain, process and understand basic health information and services needed to make appropriate health decisions. It's also described as being a wide range of skills that improve the ability of people to use this information to live healthier lives. It includes reading, writing, listening, speaking and numeracy, but it's not limited to this. There's also an element of critical analysis that's needed, and also communication skills. So we have 4 dimensions then of health literacy: how we access information or services, how we understand, then how we appraise or make that decision, and then it's about applying it to our lives. Who's affected by low health literacy? Research has shown that there are certain groups of people that are impacted more and experience low health literacy more. Older adults. This can be because of perhaps that cognitive functioning, which may be decreasing as we get older, but also they are more at risk of having had less formal education. Ethnic minorities. There can be cultural nuances that people, I suppose, experience and that are part of their culture that can be very different to perhaps the population that they're currently living in. And people with low levels then of formal education, so literacy, numeracy, and then people with low income levels also. Why does it matter? Low health literacy, it's not a new phenomenon. However, it is something that we are becoming more concerned about, and rightly so. A lot of it is to do with the large number of people affected. If you look at Europe, almost 50% of people in Europe experience low health literacy. In America, it's greater than 30%. And in Australia, it's actually nearly 60%. So research shows us that 16% of the world's population lack literacy, basic literacy skills. Really hard to say that all together. And 2/3 of this number are women. There was a European health literacy survey, and 8 countries took part in it, Ireland being one of them. And it showed that 47% had limited health literacy and another 12% had insufficient health literacy. But there was a massive gap between different countries. So in the Netherlands, it was 1.8%, whereas in Bulgaria, it was 26.9%. What are the different types then of health literacy? So we have 3 different types. The functional is basic skills and understanding. So when I go to the doctor, I'm able to tell him how I feel, and he is able to give me a prescription that I can read and then bring to the chemist. And when the pharmacist gives me my prescription, I'm able to understand how many tablets I need to take, at what times I need to take them. Maybe I need to take them after a full meal. The next level then is interactive, and this is more advanced cognitive and literacy skills, combining them with social skills. And this enables me to actively participate in everyday activities and to get new information and new meaning from different things that I'm being told, and then to apply it. So if I'm going to the doctor and perhaps I'm feeling like I'm extremely fatigued or I'm extremely stressed, and he's asking me to take a particular medication, but he's also then saying, actually, exercise would be really good here, maybe you need to do this. I'm able to take that information, process it cognitively, and combine it with the literacy skills that I have and the understanding, and say, actually, I need to do this as well, because this is an added level to it. There's also the critical type of health literacy, And this is to be able to critically analyse information that we're given. And this is to take action to create change within a community. So we've often seen communities get together and maybe decide that they want a playground or that they want a park, and within the park there are going to be exercise equipment. And that's about taking action to create that change, to encourage maybe more people to exercise, which we know has a knock-on impact on our health. So what are the outcomes then of low health literacy? There's so much research in the area of low health literacy. And there's, I suppose, there's a lower chance of certain things, but then there's also this greater risk. And that's what health literacy comes down to. It comes down to 3 domains or dimensions even. Being sick, being at risk of being sick, but also then taking action as a community. So there's a lower chance of getting your flu jabs, of understanding those medical labels. As a homeschool community liaison, and looking back on it now in hindsight, I would have acted very, very differently. I remember going on a home visit once and somebody was asking me to read a medicine label for them. And me going in like Mother Teresa said, oh, of course, and you do this and you take it then. And I left. And looking back on it now, I wish I had spent time to do that talk back piece, to do that piece where I suppose, was that understanding there? Or to maybe leave a time, maybe leave 3 times when this person should take this medication. But also it struck me that this person had been to a doctor, had been to a chemist and pharmacist, and it may have been explained, but that understanding wasn't there. There's also a lower chance of using preventative care, so preventing yourself from getting sick, because that level of understanding may not be there. And then it's about understanding those treatment options. So, you know, somebody with low health literacy, when they go to the doctor and the doctor says, you know, that there may be a diagnosis of something and these are your treatment options, that can be very overwhelming for somebody who may not understand what's being said. And I suppose psychologically within our brains, you know, the 3 different parts of the brain, we have the older part of the brain, which is the part that we used to run away from the bears when we were in the caves. That part is switched on when we feel at risk or in danger, or that we don't understand something. We may get defensive. You've often heard people say things like that, you know, when somebody says something and they feel like they don't understand what's going on, they may get defensive. So we can't move the part of the brain. The frontal cortex is the part where we actually think and we do our processing. And if I'm in the fight or flight part of my brain, I'm panicked and I'm not understanding what the doctor is telling me are my options. There's also a greater risk of taking medicine incorrectly, of a poorer health status, of ending up in hospital. There's also a risk of not going to the doctor on time and having, I suppose, a poorer prognosis. There can be inadequate self-management then of diseases, like I was saying, a later diagnosis of diseases. And also, it has found that 1 in 3 individuals with type 2 diabetes have limited health literacy. And also, people with low health literacy, and also they have higher rates of retinopathy. So health literacy in Ireland. 1 in 6 have a literacy difficulty and 1 in 4 people have a numeracy difficulty. 1 in 5 people are not fully confident they understand what their primary healthcare provider has told them during a visit. 1 in 10 have actually taken the wrong dose of medicine. And I suppose the figure that we really look at is that 1 in 4 have limited health literacy. Health literacy is one part of, I suppose, this journey towards a health outcome and how we are. And the main determinants of health, you know, the ones that we can't change, are age, unfortunately, whether we're male or female, constitutional factors, as in how our body is actually made up. That is also, they're the constant ones. They're obviously the age ones change, but the individual lifestyle factors, whether I choose to exercise, to eat healthily, they have an impact then on my health outcome. Social and community networks. If I'm feeling really alone and unsupported, that has a massive impact on how I'm feeling. And it may have an impact also on my health. There's loads of other, you know, the living and working conditions then, if I'm unemployed, my access to clean water, my access to healthcare services, to housing, to, you know, what food I'm eating, my education, my level of education, and also my work environment. My work environment is an area where I'm going every morning and I'm getting on really well with my colleagues, and there's a great support network there, and it's a job I love doing. Then I'm skipping home in the evening. I'm probably wrecked, but I'm still skipping home in the evening. Whereas if I'm going into a work environment where I'm really stressed, or I'm very anxious, or, you know, I'm working really long hours, that will have an impact then on my health as well. And then there's the general socio-economic, cultural, environmental conditions, where I'm living even in Ireland, that environmental part. The cultural part can be, I may be within a culture who believe in a certain, I suppose, part of health, and also the socioeconomic, actually what socioeconomic background I come from. This then is the integrated model of health literacy, and it puts the last few slides together. It shows that my personal determinants and my situational, where I am, have a knock-on impact on how I access, understand, appraise, and apply health information. And then we have the healthcare, disease prevention, and health promotion. These 3 domains. And these have an impact then on my health behaviour, my participation within health. And it goes from an individual level, how I am as a person and how I look at my health, to a population level. So, you know, often governments, policymakers will bring in different policies associated with health to try to improve the health conditions and the health outcomes of people. In Shanghai in 2016, the World Health Organization came up with the 3 pillars of health promotion. And these were based on these 3 pillars that you can see here. Good governance, which was the formation, which was creating systems and where people felt like they can make healthy choices, that they're accessible, and also really importantly, that they're affordable to all. This creation of healthy cities, healthy zones where, you know, people can work and play in harmony, they say, and in good health. So like those ideas where you have, you know, those city parks where you have now the exercise equipment in them, and also health literacy. And it's recognized as being, you know, that there's such a link with health literacy and health outcomes. It doesn't matter what governance you have, health cities, all the health promotion. If people are not understanding, accessing, appraising, and then applying the health knowledge, I don't know that you're at anything. So looking at migrant and minority groups, 1 of every 33 people today in Europe is a migrant. That's 8% of Europe's population. Many have low health literacy, and this has link, as I said, to lower health outcomes. Most of it was found that it was a difficulty understanding what the medical professional has written and indeed has said. There can be cultural and linguistic factors also that can act as barriers. And I think it's really important that we recognise that attempts have been made to assimilate, and most of them have failed. Instead of listening to what the health belief of the person from a particular culture is, we've basically at times said, no, this is what we do. So now we're looking at this and saying, okay, let's show that the idea and the value of this person who is a migrant from a minority group, that we have regard for that. And Mahatma Gandhi said that no culture can live if it attempts to be exclusive. So what's the impact then of low health literacy on mental health and self-esteem? If I'm going to a doctor and he's talking about abdominal pains and ultrasounds and colitis, and I'm not getting any of that understanding, then that has a massive impact on my mental health, because I can leave the surgery and feel like he's giving me really bad news, when actually he may not have. Or the opposite, I may leave the surgery thinking that's grand, when actually it may not. It also has an impact on your self-esteem. If I don't understand what somebody is saying to me and it's supposed to be this two-way dialogue, it has a massive impact on my self-esteem. I'm probably going to be less motivated to do anything. If I go to a doctor and really understand what he's saying, and he has told me, or she, that I can do something about this, that I can actually, adapt maybe a new habit that might help me, maybe exercise, then I might be more motivated to actually do it. But if I don't understand what he's saying, I'm going to be less motivated, and actually I'm going to be less likely as well to make those healthy choices. Never has this been more important, mental health literacy. Obviously, as a therapist myself, I just think it's so important that people can understand how to get information about mental health and how to get information that's correct and that they can feel like they're a part of. For me as a primary school teacher, I see it with children. I've worked with parents. I now work as a therapist, and I can see that mental health literacy is so important. It's absolutely paramount. And in the next couple of months, we're going to see it even more. Going to a doctor because you have a pain in your stomach can be difficult for people with low health literacy. Going to the doctor with low mood or anxiety can be very, very difficult. I've completed research on mental health needs in disadvantaged groups, and it can be much higher. We've seen the statistics. It can be much higher in minority groups and migrant groups for many, many different reasons. And there can be a massive stigma around mental health and mental health literacy as well. And I think it's really important that we focus on reducing that. I think we can all play a part in that. I remember reading an article before on A Lust for Life on even therapists have bad days, and actually saying to people, we all have those bad days. And maybe that's when, every interaction, is an intervention. Maybe when we meet people who we're working with as a tutor or a homeschool, that we can say, I'm not having a great day. We talk a lot around boundaries and, keeping our boundaries, and they're so important. But that connection part comes when we show that we're human as well. Health literacy then, as I said, in a pandemic, it has highlighted what an underestimated problem this is globally. Health literacy helps people to understand the reasons why governments are, bringing in rules and it's coming in at 8 o'clock the next morning. And it helps us to understand on, if I do this, what the outcome of this is. So if I'm going to the shop and I'm wearing a face covering, I know I'm protecting others and hopefully protecting myself as well. And there's that social responsibility, thinking beyond our own interests and keeping ourselves safe, which is really important as well. But it'll also help us to understand how people make choices. The World Health Organization have actually said we're not just fighting an epidemic, we're actually fighting an infodemic, misinformation. Leads me on nicely to this next slide. I suppose fake news and false information, especially at a time now when we're in a pandemic. We are, people need digital and health literacy to be able to distinguish between what's fake news and what's fact, what we need to do. There's a lot of people talking at the moment, and there's a lot of conspiracy theorists about what's going on. And this is so important because immediate and rapid action is required. There was nobody else I could put on that slide but Mr. Donald Trump himself. So now looking at empowerment. Paulo Freire is an educator, and I'm a massive fan of his. He, I suppose, looks at this bottom-up perspective, which is not that as a teacher, I'm filling this child as the empty vessel with all of this information. And I liken it to the doctor-patient, where the doctor gives all the information and the patient, like the child in the classroom, takes in all the information. It's more this active participation. And as teachers, we have, I suppose, we've learned and we've seen that when children are actively involved and participating in their education and their learning, they're going to remember it. So the same needs to be applied for health literacy. It's that active participation, and it is based on dialogue between both parties. And it's to help people understand reality, giving them facts. And he says that empowerment can't be given from one person to another, but it must emerge from within. And how do we do that then? How do we actually empower somebody who may not understand what a doctor is saying, or that their life choices may not be conducive with healthy outcomes? What can we do? Looking at the health literacy umbrella, you have the RAIN, and that are the health problems. It's about looking at what shields us from this RAIN. And there's 3 parts to it. Building those relationships. I'm a massive advocate for building relationships and the importance of that. And building relationships is about respecting the values and preferences of people, but also looking at ensuring this understanding, which brings me back to the day that I did the home visit. Did I do a follow-up? Did I have a clear dialogue? Did I use plain language? Did I use a term that maybe the person didn't understand? And it's also about that support, that peer support, finding somebody that is perhaps from their community, finding maybe a family member. There's so many ways that we can, it's not just policymakers, that we can have an impact on health literacy. Just to say there as well, just the identifying key groups, it is really about, knowing your audience. I suppose that effective communication piece is always based on knowing your audience and being able to, I suppose, adapt to the audience. And just because a message is said, it doesn't mean that it's understood. So somebody you're working with may have gone to the doctor and may have been told something. But just because you're told something, it doesn't mean that you can critically analyze it and actually understand it. And maybe you can with time. So maybe it is about giving people that opportunity to have that time to consider it. So because it is Literacy Week, I thought it was a good idea to just look at some reading resources for parents who have low literacy levels and based on health as well. So these are some that can be done with children, and they are YouTube links which look at My Strong Mind, the power of positive thinking. It's going to be really, really important for children to be able to have strategies that help them with anxiety and how they're feeling. And there's also this other link there, Good for Me, Good for You. It's a book and it talks about healthy life choices. So because somebody has low literacy levels, it doesn't mean that as a parent they can't work with their child to explore healthy outcomes together. These are some other books then, I suppose, that are wordless picture books. So the parent can look at them and come up with the story based on the pictures with their child. I think that's really, really important. And another really good idea is to make homemade ones where there doesn't have to be a lot of text. There doesn't have to be, you know, paragraphs and paragraphs of writing. It can be a cartoon strip, and it's something that they can do together as well. When I was exploring health literacy, and you could actually do a 4-hour webinar on health literacy, I suppose I found this poem, and it was at a mental health convention in Scotland. I think it was Edinburgh in 2006. And this is Elspeth Murray, and she explores health literacy and low health literacy from the perspective of the person who is experiencing it and who may have gone to a doctor or, you know, a healthcare provider. But I do think that this poem can impact and maybe give us all a little bit to reflect on, and how we are dealing with people who may have low literacy levels, low health literacy levels, and what may be needed from us. I'm hoping this works now.
This is bad enough. This is bad enough. So please don't give me gobbledygook. Don't give me pages and dense pages and this leaflet aims to explain. Don't give me really dodgy photocopying and do not remove for reference only. Don't give me drafted in collaboration with the multidisciplinary stakeholder partnership consultation short life project working group. I mean, is this about you guys or me? This is hard enough, so please don't leave me oddly none the wiser or listening till my eyes are glazing over. Don't leave me wondering what on earth that was about, feeling like it's rude to ask or consenting to goodness knows what. Don't leave me lost in another language, adrift in bad translation. Don't leave me chucking it in the bin. Don't leave me leaving in the state I'm in. Don't leave me feeling even more clueless than I did before any of this happened. This is tough enough, so please make it relevant, understandable, or reasonably readable at least. Why not put in pictures or sketches or something to guide me through? I mean, how hard can it be for the people who are steeped in this stuff to keep it up to date? Do you know what I'd appreciate? A little time to take it in, a little time to show them at home, a little time to ask, what's that? A little time to talk on the phone. So give us the clarity right from the start. The contact's there at the end. Give us the info you know you need to know. Show us the facts, some figures, and don't forget our feelings, because this is bad and hard and tough enough. So please, speak like a human. Make it better, not worse.
I don't think there's any other way to sum it up. I think she sums it up perfectly. I think it is about considering feelings. I think it can be very, very hard for people. And I think that it's really important that we don't underestimate how people are feeling when low health literacy is a factor. Okay, Fergus.
Nicola, thanks very much. That was great, really insightful. Really enjoyed that. I could see it was great that you showed us the strong link between health literacy and health outcomes, and that poem just summed it up at the end. Helen, my colleague Helen Ryan, works in health literacy in NALA. Helen, have you any further comment to add?
Well, that was brilliant, Nicola. Thanks a million. It's always great to see someone